information, facts, and figures, but there's a little Kelley in there too. So I just want to say that based on my background and based on where I've been, helps shape some of my opinions about this. It's not just going to be my opinions though. We have this wonderful base of representatives who we're going to introduce a little bit later. But yeah, just wanted to say that. So diversity, what about it? So there's two sets of definitions that I'm going to introduce. This is our first set. Basically, just talk, first of all, that's what Merriam-Webster expects you to know how to pronounce it. It's hilarious. So the first set of definitions that I want to talk about is talking about differences. The quality or state of having many different forms, types, ideas, etc. The state or fact of being diverse, difference, unlikeness. So what I'm going to do is I'm going to take you through a little journey through time. I'm going to talk about the historical context of diversity, how that historical context influences us today, and what kind of steps are going to be taken in the future to address these issues. And I say issues with purpose, because I want to put in a little plug to say that I'm one of 2 black students in my class of 104. So, on the fabric of the American is the American dream. That's kind of the foundation from which everything was built upon, right? That everyone has access to life, liberty, and the pursuit of happiness. It's a really cute dream. I think it's awesome in theory, but it's not exactly as realistic because you have these people coming from all walks of life, all walks of the earth to come to the States and try to pursue this American dream. But with all of this difference comes marginalization. And so when I say marginalization, it's just a characterization of diversity. You have these really separated groups based on their cultural identity, their country of origin, the language they speak, what type of professional jobs they pursue, what values they carry in the household, how they navigate their day-to-day. It's very, very different. These groups are then marginalized. That's when you start to see this difference. And I love Mean Girls. And so, but it's a perfect example about how there's these really separate groups, especially in an environment as small as high school. Now put that in the larger scale of the American nation. And so we have these really marginalized groups, typically of minorities. But with this heterogeneity, it's awesome. Like, we have this diversity in our nation, and it's very heterogeneous population, and this really great amalgamation of cultures. But with that, we're not socialists or communists. So with that is going to come an inherent inequality. There is no way that you're going to have a heterogeneous population and a homogeneous distribution of resources. It's impossible. There's no way that every group that has separate, in the context of health, separate health concerns, diets, typical exercise regimens, needs, is going to have the same or equal access to resources. Now, the most obvious that we like to talk about in the context of medicine, since we're all aspiring or current physicians, is access to healthcare. Now, I want to give a little golf clap to Barack Obama because he did make a serious step in the right direction with the Affordable Care Act. That's an entire conversation in itself, but basically it did help alleviate the burden that is people without insurance. But I want to draw your attention to the fact that the people who are still uninsured, and this is, the people who are still uninsured belong to Hispanic and Latino populations, American Indian, Native Hawaiian, Black, and then everyone else. So to see that the majority of our population that's going uninsured are people of color, that's alarming. That's alarming, and that's not by accident. Because we had this marginalization or separation. We had this inherent inequality, and then are we surprised that people are then without insurance? Now, without insurance comes unequal distribution or prevalence of disease. And so I want to draw your attention to this chart presented by the American Heart Association, which draws attention to both level of education, which I don't need to present a fact or figure, I don't need to present a published work to say that people of color tend to be less educated. That's a fact. If you want me to Google it, we can talk about it later, but it's a fact. And so it's not so surprising that people who are uneducated have a higher prevalence of disease because a lot of type 2 diabetes has to do with lifestyle. But I also want to draw your attention to the fact that there is a significantly higher percentage of people who are suffering from type 2 diabetes that belong to groups of color. It's no surprise. You don't have access to healthcare. You don't have access to the proper medication. You don't have access to a primary care physician to be seen about these types of illnesses. So it's not surprising that we see this difference in percentages of prevalence of type 2 diabetes. So that's diabetes, but let's just, do I even need to talk? Just look at the colors on the screen. I don't even need to mention a percentage to realize that this is an issue. The fact that Black people, 81% of prevalence of HIV, human immunodeficiency virus, affects Black people, that's a problem. But are we surprised when we had unequal access to healthcare? A completely, basically preventable disease. So, as of yesterday, there were 322 million people on this earth. About a third of those comprise people of color. So that's roughly 100 million people of color. And they're still disadvantaged. Now, why they make up a third of our population, and the Census Bureau claims that that number is only going to increase, while they make up about a third of our population, they control a very, very small percentage of our nation's wealth. This is surprising. And I know you might look at it and say, oh, it's 2011, things have changed, progress. Okay, that's cute. But I guarantee you there was not a $100,000 increase in the wealth of people of color. That didn't happen in the last 4 years. So even if this number is now 102 instead of 104, or 100 instead of 102, that's awesome. But when you're looking at wealth, and when we talk wealth, it's not just income, that's also talking about assets, the car you drive, the house you own, etc. And there's a significant wealth gap, even though people of color, and let me just put in a little plug, Native Hawaiians and American Indians aren't even included in this study because the wealth that they actually control is statistically insignificant. That's how small it is. So then we talk about how people of color make up roughly a third of our population. So if you're looking at these numbers, I'll draw your attention to the column most at your left. First, that talks about the distribution in our nation, broken down into race. Yes, whites make up the majority. Then if you then look to the next section of matriculants actually entering medical school, and how those numbers stay pretty consistent with white students, but drop in every other category. Then if you then look at actual practicing physicians in the physician workforce, those numbers are even more significantly, or there's a significant gap in those numbers. The disparity is really astounding, and I'm going to talk about why this may be. Take a second, just look at that. It doesn't add up. It just doesn't add up. So, you guys are pre-meds, a lot of people in this room. I pulled these numbers on your left from Kaplan Test Prep. For a show of hand, who has $3,000 to drop right now? I sure don't, unless it's loan money. So the average student definitely doesn't have $3,000 to drop in an MCAT prep course. They don't. I don't know who you are, maybe someone somewhere, but not in this room. And then you then look at how much it costs, and mind you, this is no guarantee of doing well. That's just a guarantee that you will be able to sit in front of a tutor who will teach you to how to possibly do well. That's no guarantee of you actually performing well on the test. Then we then look at how much it costs to actually have a seat in front of a computer to take this test. $300. Now, in undergrad, $300 was food, that was Uber, that was laundry, that was books, that's a lot of money for the average student. And that's how much it costs to just sit in front of a computer and take the test. God forbid you don't do as well as you wanted to the first time and have to retake it, which is actually very common. So you're now in the whole, and even if you don't, okay, let me put in a little plug, you don't have to drop thousands to study for the test. I didn't, and there's other resources, but if you look at the best of the best opportunities and how we talked about the significant wealth gap and who do you think has access to the best of the best training here? Is it people of color? No. And so then, and I also want to put in a little plug to say that there's a program called the Fee Assistance Program, aamc.org/FAP. And what it is, it basically cuts this registration cost in half, and it also gives you some subsidized costs for the actual application process, which I'll talk about in a second. But everyone in this, write it down, everyone in this room should apply aamc.org/FAP. Even if you think your family won't cut it, apply anyway. It may do wonderful things for you. So then we talk about how people have this unequal access to resources. It's cost way too much money to study for this test, and then are we then surprised that there's a disparity in test scores? The average white or Asian student scores roughly 5 points above the student of color. Now, you guys are kind of aware of how the MCAT works, right? The difference between a 30 and a 25 is significant. That is literally the difference between you getting into schools and not. There are schools that will, now, he knows this, the holistic application process is awesome, but not all schools process it. So they will look at an application, see your metrics, and flip if you don't hit a certain number. So think about how many people are then out of the running for medical school because these averages are so different. But are we surprised? When you have unequal access to resources, when you have unequal access to training and prep materials, are we surprised that then people score less? I'm not. Then we step into the application process. So the American Medical College Application Service, it's cute. It's like a Common App for undergrad, for those who are just getting interested in the medical school application process. And to just even open the application process and submit even one application, $160. You tack on any school on top of it, it's an extra $36. So are you doing the math? The average student applies to roughly 15 schools, let's call it. And then a lot of schools will give you back secondary just because they want the money out of you. It doesn't matter who you did well. But some schools will screen, so if you didn't get that certain metric, they won't even send you a secondary. But then we have secondaries that are anywhere from $25 to $100. Now let me say, more schools fall in the $50 to $100 range than the $25 to $50 range. So if you apply to 15 schools, got 12 secondaries back, you've already dropped 4 figures on applying. That is not a guarantee of getting an interview. That's not a guarantee of getting into the school. That's just so that admissions committee has the opportunity to possibly look at your application. You've dropped 4 figures between studying for the test, taking the test, and applying to the schools with no guarantee of getting in. And you are one of roughly 6,000 to 8,000 applicants who turn in applications just like yours, who have resumes to the floor, who have taken, I'm coming out straight out of undergrad. I'm in a pool of people who have masters and were EMTs and scribes and traveled the world, and I'm like, I graduated. And so the fee assistant program is awesome because a lot of your secondary application fees will be waived, which is really, really awesome, so that's why I say apply. aamc.org/FAP. So this is how much money you spent just to apply. Now, woo, you got an interview, you applied, you got one. Let's say you got, if you submitted 12 secondaries, you got, say, 6 interviews. That's awesome. Now, if you live in the West Coast and you're trying to go to school on the West Coast, and you can take a little bus or a train to get there, and that's awesome, or you can drive down or something. Or if you're like me, who went to school on the West Coast and wanted to come back home, you hop on a flight. Or if you're really like me, you hop on the ghetto airline and you hope that you can get there. If you talk about average cost of a flight, it's not the kind of thing where they say, oh, let's work around your schedule, let's see what works for you. You know, we'll set you up in a hotel, let me get your flight. No, it's here's a date, get here. And they'll give you about a 5 to 6 week notice probably. So if you're like me coming from across the country, how much does it cost to get from DC to LA in a month's notice? $400 or $500. Now, do you have an extra $25 to then drop on interviews? That's $2,500. That's nothing to bat an eye at. So now you've spent however many hundreds of dollars studying for the test. You dropped $300 to take the test. You spent 4 figures applying to these schools. You're dropping another 4 figures just to get there, and still no guarantee of anything. You're just having the opportunity for someone to have FaceTime with you and hope that your suit looks cute enough for someone to let you into the school. This is no guarantee of anything. And we talked about a wealth gap. Who is this process designed for? Not the people in this room. This is an elitist application process by nature. And all we can do is hope to be the statistic that breaks this cycle. Then are we surprised that these numbers are different in matriculants and actual practicing physicians? Are we surprised that there's not as many people in this room have had a pre-health conference designed for white students? No, I'm not. So then you got in, that's awesome, you got into school, and then you get that nice little bill. And if you're coming to a public school, you're paying on average about $36, I think it is here, about $36. If you're going to a private school, it's about $50. Now times that by 4, God forbid you want to get a master's, God forbid you want to travel at some point, you're already $200,000 in debt, beyond the thousands that you dropped to apply to the program, beyond the thousands that you dropped to study for the test, and now you're in this debt. So if you're the average student of color who is working a job to support their family, or got here on their own, they have no guidance, they're the first generation person to ever pursue a career in medicine, because I have the classmates who are like, yeah, my parents are doctors, and they put me on. And I'm like, oh, that's cute for you. But now you're in this place where you have a significant debt load. So how many people are necessarily going to be inclined to even pursue this, knowing how much debt they're going to incur at the end of it? So I want to draw your attention to why this is an issue, beyond the obvious reasons of inequality. Why this is an issue? Well, the census said around the time the 2020 census, which is when we graduate, around the time the 2020 census is conducted, more than half the nation's children are expected to be part of a minority race or ethnic group. This proportion is expected to continue to grow so that by 2060, just 36% of all children will be single-race, non-white Hispanic, or non-Hispanic white, compared to 52% today. So I want to put a little plug about a series of studies that have been done that say physicians of color are more likely to serve or provide medical services to people of color. On the flip side, patients of color are more likely to seek physicians of color. So this is a significant problem when you have a growing population and a growing need and a decreasing amount of people to address that need. It's an issue. It's an issue, and that's why I really want to draw your attention to this issue today. So I'm going to draw your attention second to the second set of definitions, and this is how dictionary.com diversity. The second set of definitions, which talks about the state of having people who are different races or have different cultures in a group or organization. The inclusion of individuals representing more than one national origin, color, religion, socioeconomic stratum, sexual orientation, etc. So this is not an issue that only affects people of color. It's not. If you're pursuing medicine, guess what? Your patient base is going to be brown. It's going to happen. And it's not only an issue that can be addressed by people of color, because they only make up a third of our population, and roughly 20%, 15% of people who are actually in medical school or practicing physicians. So this is an issue that needs to be inclusively addressed. So we're going to talk about how that works in a bit, but I want to draw your attention to the idea that it's awesome that you're here. You people are the people who are interested in these issues, but go and tell your friends about this, because they need to be included in this discussion in order for these issues to be addressed. So what we're doing on campus, we have an Office of Diversity spearheaded by this lovely man here, Dr. Marco Angulo. The Office of Diversity on campus is titled MEDICS, the Medical Education, Diversity, Inclusion, and Community Service. And it serves as an umbrella office that houses what's called the Diversity Coalition, a series of organizations that represent our diverse student population. So PAMSA, the Asian Pacific American Medical Student Association, LMSA, who's hosting this conference, FAME, the Filipino Americans in Medicine, Equality, that represents our LGBTQ students, and the Student National Medical Association, who I'm going to talk about. And so I want to then take a second to let my panelists introduce themselves, talk about what organizations they represent, what their basic thoughts on this is, and then I want to really open the floor for discussion. Okay?